Anatomy of female sexual pleasure. The female pelvic anatomy remains filled with fascinating mysteries regarding the stimulation and recognition of pleasure zones, as well as the potential for experiencing orgasms. Understanding female sexual anatomy allows for easier identification of areas of pleasure sensitivity. This knowledge helps enhance levels of pleasure and, in many cases, increases the possibility of orgasm. The sexual act and pleasure zones. This animation presents a sagittal view, illustrating the resting position of the penis in a coiled configuration during missionary intercourse. It reveals a direct connection between anatomical structures linked to heightened sexual sensitivity and the contact points created where the base of the penis meets the vulva. Most of these highly sensitive regions are concentrated in the outer third of the vaginal canal. These sensations are greatly influenced by the angle and placement of the penis relative to the vaginal entrance. The inner two-thirds of the vagina are less involved in pleasurable sensation, as they are not densely packed with sensory nerve endings. Accordingly, penis length does not significantly affect sexual pleasure in women. Instead, girth plays a more substantial role, as a thicker penis increases contact with these sensitive areas. Certain surgical procedures aimed at narrowing the vaginal canal, specifically the outer third, are designed to enhance friction and boost pleasure during intercourse. This modification seeks to heighten satisfaction by increasing stimulation in areas where nerve density is highest. Clitoris. Clitoris and other related organs are central to the phase of sexual arousal. Clitoris serves the exclusive role of providing sexual pleasure to women. It is as vital to female sexuality as the penis is to male sexuality. Clitoris consists of the same tissue type as the penis and largely behaves similarly during sexual stimulation. Some clitorises may be as large as a small penis. The main parts of the clitoris. The three major parts of the clitoris are the glans, the clitoral body or shaft, and the clitoral crura or foot. Right before a woman experiences orgasm, blood accumulates in the clitoral body, resulting in a firmer erection that causes the glans to shift upward toward the pubic bone. This erection gives the appearance that the glans is retracting beneath the clitoral hood, but it is actually straightening due to the trapped blood volume. Clitoral erection during arousal. From the front and side views, these animations depict the vulvovaginal responses to sexual arousal, showing the erection of the clitoris and the swelling of the vestibular bulbs. There is an increase in blood flow to the vulvar region and around the base of the urethra. Based on bibliographic sources from the Atlas of Human Sexuality featured at the end of the video, a link can be observed between higher sexual arousal and how close the clitoral glans is to the urethral opening. A conclusion reached through the analysis of over 200 subjects found that women whose clitoris-urethra distance was less than 2.5 centimeters always reached climax during intercourse. Distances between the clitoris and urethral meatus and their impact on sensation. Note: a clitoris-urethra distance under 2.5 centimeters is associated with greater sexual satisfaction. Important anatomical distances in female pleasure. Clitoris and its accompanying veins, arteries, and nerves are collectively key to sexual sensitivity. The glans of the clitoris has as many nerve endings as the penis glands, but concentrated in a much smaller space, making it highly sensitive. Clitoral glands nerve endings number about 8,000, while penile glands endings are around 4,000. Main nerve zones involved in sexual pleasure. In this animation, the pink highlighted areas, mons pubis and upper labia majora, are innervated by the ilioinguinal and genitofemoral nerves. Yellow-marked femoral areas are supplied by the posterior femoral cutaneous nerves. Pudendal nerve innervates the remainder of the vulva and the perianal region. High sensitivity zones. The vaginal nervous system varies along its length. The outer third belongs to the somatic nervous system, while the inner two-thirds are part of the autonomic nervous system. There's a transitional zone where both systems overlap. This means the outer third of the vagina can sense a variety of stimuli, while the interior is more responsive to pressure and pain. One of the most complex nerve regions lies near the periurethral glands, frequently cited in literature as the G-spot. Due to the proximity of nerves from the clitoris, vagina, and urethra, stimulation of the anterior vaginal wall is often reported as more intense. Childbirth, pelvic surgery, and trauma to the vulva or clitoris can impair sensitivity and reduce the perception of sexual sensation. Summary of female pleasure anatomy. To enhance levels of sexual pleasure, understanding the basic anatomy and its physiological changes during arousal is essential. Summary. Clitoral erection. Clitoris has the sole function of providing women with sexual pleasure. The nerve endings of the clitoral glands are about 8,000 and the terminations of the gland's penis are about 4,000. The outer third of the vagina is sensitive to a range of sensation. The angle and position of the penis in front of the vaginal opening affect pleasure levels. The inside of the vagina is mainly sensitive to pressure and pain. Women have indicated that the front wall of the vagina is more sensitive to stimulation. The length of the penis does not affect the female sexual response much. The thickness of the penis would directly affect arousal because a wider thickness directly affects the pleasure zones. Irrigation and widening of the anorectal veins. A clitoris urethral meters distance of less than 2.5 centimeters is associated with greater sexual satisfaction.